So the first step I take, of course, is to log into the legacy provider portal. Okay, so we click go. And now we are logged in to the legacy portal. Okay, now I'm going to log into eHealth Suite. Same username and password. And submit new claim. And there's just one hyperlink, the CMS 1500 claim. So in box 1A under insured's ID number, we don't have to type anything. We click on the icon that looks like a magnifying glass. And then in the second field where it says member number, we're going to type or paste that member's health suite number. And we click search. And then the patient's name appears. We click on the patient's name, and that populates. So you can see the health suite number, the member's name, address, phone number, et cetera, date of birth. Second step, box 2, patient's name. Click the magnifying glass icon, click on the patient's name, the hyperlink for the patient's name, and the upper left corner of the form populates. The diagnosis code. Oh, and of course there's the ICD indicator. There's only room for one digit here in this box, so you type 0, and that relates to the diagnosis codes. Diagnosis codes generally have a decimal point, but here you would not put the decimal. If there's more than one diagnosis code, the provider would fill the diagnosis codes in order of importance. Dates of service. Yes, absolutely. And they would fill that in. Generally, it's 1 day to 1 day. Many of our behavioral health providers at this time are rendering their services over the phone. So that's through telehealth. Column C, they leave that blank. Now column D or box D, CPT code, or they can click a magnifying glass and bring that up. Now modifier. The purpose of a diagnosis pointer is to point or relate the CPT code on this line item to the appropriate diagnosis code in 21. So if they need to associate this service on this line item with the diagnosis code in box A of 21, they've got to put A for the diagnosis pointer. Of course, they would add the total charge for that line, not the unit charge, but they would put in the total charge. And then days or units. And then box H or column H, they disregard that. Column I, they have no access to. So this is where the magnifying glass comes in again. So they click that. The only two fields that they have to interface with here are the two that have the asterisk. So there's the plan product or line of business. That's going to be Medi-Cal. And then facility name, last name. Okay, we click search, click that. And his health suite number appears right here. Box 32, service facility location information. Click the magnifying glass. Okay. Select a provider. Okay, and that's filled in. And the billing provider is already filled in. That's pre-filled in. Given that the form has been filled out completely, clicking the Save button will submit the claim.